Good day everyone, I'm Princess Taug and I will be the one to discuss the Kartagener syndrome. So what is Kartagener syndrome? It is a rare genetic disorder that causes a defect in the cilia that line the respiratory tract and other organs. This condition is also known as the primary ciliary dyskinesia. Cilia has a dentin arm and these are essential for the movement in cilia. The problem with the Kartagener syndrome is the absence of dentin arm. So if there is no dentin arm, the cilia cannot move. Therefore, the places that have cilia which are not moving will be affected, such as the paranasal sinuses that lead to sinusitis, the mucociliary escalator that lead to bronchiectasis, the flagella in sperm that lead to male infertility, and the fallopian tube that lead to female infertility. So for the paranasal sinuses, the sinuses secrete mucus that traps dirt, dust, and pollutants protecting you from the infection. So impaired function of the paranasal sinuses can lead to sinusitis because the sinuses rely on a delicate system of drainage and mucus clearance, which involve in cilia that line the sinus cavities. Next is the mucociliary escalator. It is a defense mechanism in the lungs that removes particles and pathogens from the airways. Impaired mucociliary clearance leads to the bronchiectasis because it results in the accumulation of thick mucus in the airway, which promotes chronic infections and inflammations. Next is the flagella in sperm. Impaired flagella in sperm can cause male infertility because the flagellum or the tail of the sperm is essential for motility. So it is the ability of the sperm to swim towards and fertilize an egg. So if the flagellum is dysfunction or absent, sperm are unable to swim effectively, which significantly reduces the chances of successful fertilization. Last is the fallopian tube. Impaired cilia in the fallopian tube can cause female infertility because the cilia are crucial for movement of both the egg and the fertilized egg through the fallopian tube. If ciliary function is impaired or damaged, the egg may not be transported properly, preventing fertilization or causing failure to embryo implantation. So for the signs and symptoms of Kartagener, first is the nasal congestion. It occurs because of the defective or immotil cilia in the nasal passages and sinuses fail to clear mucus and pathogens effectively. This leads to the accumulation of mucus, resulting to blockage, inflammation, and chronic infection like sinusitis. Next is the cough. Due to the inability of the cilia to clear mucus effectively, which leads to mucus accumulation in the airways, this triggers chronic respiratory infections, bronchiectasis, sinusitis, and postnasal drip, all of which cause persistent coughing as the body attempts to clear the mucus and irritants. Next is the difficulty of breathing. The impaired ciliary function leads to mucus buildup and inflammation, which block airways and reduce lungs function. These factors makes breathing harder and lead to the common complaints of dyspnea or the difficulty of breathing. Next is lung infection. Lung infections are primarily due to the impaired ciliary function in the respiratory tract, which leads to mucus buildup, airway obstruction, and recurrent respiratory infection. And lastly is the wheezing. So wheezing in Kartagener syndrome is mainly a result of airway obstruction, inflammation, and the accumulation of mucus that makes it harder to air to flow freely in and out of the lungs. For the risk factors, first is genetic inheritance. Kartagener syndrome is inherited in an autosomal recessive manner, meaning that a person must inherit 2 copies of the defective genes, one from each parent, in order to develop the condition. Next is the family history of Kartagener syndrome. Since Kartagener syndrome is caused by mutation in the genes responsible for ciliary function, having family members with ciliary dysfunction disorders raises the risk. Next is the consanguinity or the marriage between relatives. Consanguinity refers to the marriage or reproduction between close relatives such as cousins. In consanguineous marriage, there is a higher chance of both parents carrying the same recessive genetic mutation because they share a common ancestry. So, for the pathophysiology, the predisposing factors is genetic inheritance. Kartagener syndrome is inherited in an autosomal recessive manner. This means that both parents must carry and pass on the mutated gene for the child to develop the syndrome. Next is the mutation in genes. So the primary cause of Kartagener syndrome is the mutation in genes that affect the structure and function of cilia. So for the precipitating factors, first is the respiratory infection. Individuals with Kartageners syndrome are highly susceptible to chronic respiratory infection because of impaired mucociliary clearance. Next is exposure to environment irritants. So, exposure to cigarette smoke, air pollution, or the respiratory irritants can precipitate respiratory symptoms or infection in individuals with Kartageners syndrome. Next is the changes in weather. So, extreme temperature fluctuation or dry air can irritate the airway and make mucus thicker and harder to clear, thus precipitating respiratory distress in individuals with Kartageners syndrome. So, the Kartageners syndrome is a rare genetic disorder characterized by impaired ciliary motility, which affect the normal function of cilia in various organs. The condition is caused by mutation in genes that result in defect ciliary structures or functions, particularly in the respiratory tract, fallopian tube, and sperm. In the respiratory system, the inability of cilia to beat properly leads to ineffective mucociliary clearance, causing mucus to accumulate in the airways. The accumulation promotes chronic respiratory infection, bronchiectasis, which is dilated and scarred airways, and sinusitis. Over time, repeated infections and inflammation cause structural damage to the airways, leading to bronchiectasis, permanent dilation and scarring of the bronchi. This further compromises the ability to clear mucus, exacerbating airway obstruction and reducing lung function. The chronic inflammation and mucus buildup also lead to hypoxia and impaired gas exchange, causing symptoms like shortness of breath, wheezing, and fatigue. So for the anatomy and physiology and respiratory system, cilia in the airways. So it is a tiny hair-like projection in the respiratory tract that work with the mucus to clear pathogens and debris from the airway. So the respiratory tract is lined with ciliated epithelial cells, particularly in the nasal passages, trachea, bronchi, and bronchioles. These cilia beat in a coordinate fusion to move mucus and trap particles out of the lungs. In Kartageners syndrome, the ciliary motility is impaired, leading to mucus buildup and increased the risk of respiratory infection. Next is the sinuses. The sinuses, also known as paranasal sinuses, are a complex system of air-filled cavities in the skull and face that work with the nose to perform a variety of functions. So cilia also line the sinuses, where they facilitate the drainage of mucus. In Kartageners syndrome, the dysfunction of cilia results in chronic sinusitis and nasal congestion due to a poor mucus clearance. Next is the lungs. So it involves the movement of respiratory gases, the exchange of oxygen and carbon dioxide, and the circulation of blood. The condition can lead to bronchiectasis, where the bronchi become permanently dilated and scarred, impairing airflow and contributing to chronic respiratory problems like cough, shortness of breath, and recurrent infection. So for the reproductive system, for the fallopian tube, the cilia in the fallopian tube are responsible for moving the egg from the ovary to the uterus. In Kartageners syndrome, the impaired movement of these cilia can cause difficulty in egg to transport, leading to female infertility. So for the medical management, first is the antibiotics. It is used to treat respiratory infections that are common in Kartageners syndrome. Some patients may require long-term, low-dose antibiotics to prevent recurrent infection. Next is the oxygen therapy. For patients with significant lung damage and impaired gas exchange, oxygen therapy may be required to maintain adequate oxygen level in the blood. It can provide via nasal cannula or a face mask, particularly during period of increased respiratory distress. So for the surgical management, first is the lung surgery. Lung surgery is a surgical procedure that involves removing or repairing lung tissue to treat the variety of conditions including lung cancer, COPD, and bronchiectasis. Next is the functional endoscopic surgery. Functional endoscopic surgery is a minimally invasive surgery for the serious sinus condition. Next is the bronchial resection. A bronchial resection is also known as a sleeve resection or sleeve lobectomy. It is a surgical procedure that removes a portion of the main bronchus and a lung tumor in a lobe of the lungs. So for the nursing management, in respiratory assessment, check the vital signs. Monitor the respiratory rate, heart rate, blood pressure, and oxygen saturation. An elevated heart rate Tachypnea or hypoxia may indicate acute respiratory distress. Next is auscultate the lungs. Listen for the abnormal lung sounds such as crackles, which suggesting infection, or bronchiectasis, wheezing, suggesting airway obstruction, or decreased breath sounds indicating poor lung ventilation. Next is assess the characteristic of cough sputum. Assess the characteristic of the cough, or such as productive or dry, and sputum, example the color and the consistency. The purulent thick sputum may indicate bacterial infection. Next is palpate the sinuses from the frontal and maxillary for tenderness or swelling. Next is inspect the nasal. Check the nasal polyps, signs of infection or drainage. Thick greenish or yellowish discharge may be indicate of bacterial infection. And lastly, assess for the other signs and sign of sinus infection such as fever, fatigue, or a worsening cough that might indicate postnasal drip. So for the intervention, first, continuously monitor vital signs, particularly respiratory rate, oxygen saturation, and lung sounds. Because monitoring vital signs help detect early signs of respiratory compromise. Next is encourage and assist with chest physiotherapy techniques such as postural drainage, percussion, and vibration. So these techniques helps mobilize and clear mucus from the airways. Next is provide supplemental oxygen if oxygen saturation drops below normal levels. So oxygen therapy can maintain adequate oxygen levels, preventing hypoxia and cardiac strain. Next, teach patient effective coughing techniques such as half coughing and encourage deep breathing exercise. So half coughing and deep breathing exercise help in clearing the airway and preventing infections by reducing mucus stasis. Next is encourage the patients to drink plenty of fluids throughout the day. So adequate hydration helps thin mucus, making it easier to expectorate. For the patient education, educate the patient and family on airway clearance techniques such as chest physiotherapy, postural drainage, and percussion. Next, explain the importance of hydration to help thin mucus and the use of saline nasal sprays or nasal irrigation to manage sinus congestion. Next is smoking cessation education if applicable. So for the nursing diagnosis, first is impaired airway clearance related to mucus accumulation as evidenced by productive cough, wheezing, and decreased oxygen level. Next is impaired gas exchange related to dysfunctional ciliary motility as evidenced by decreased oxygen level, wheezing upon auscultation, and increased respiratory rate. Next is risk for infection related to impaired mucociliary clearance. And that would be all. Thank you.